Hi, and welcome back to another Stepping Forward Technology video. My name is Matthew McCann, I'm the head of security, and today we are going to be discussing HIPAA compliance. HIPAA stands for the Health Insurance Portability and Accountability Act. It's a federal law passed in 1996 in the United States and has been updated several times to enhance its requirements. Its purpose is to protect sensitive patient information and to make sure it's handled properly, especially as healthcare moves away from paper and into digital systems. Let's discuss why HIPAA was created in the first place. When HIPAA was first introduced, the healthcare world was starting to digitize patient records. It made it easier to store and share information, but also created new privacy and security risks. So HIPAA was designed to do several things. Protect patient privacy first and foremost, ensure health data is secure, gives patients more control over their own medical information, it simplifies the health insurance coverage when people change or lose jobs, and it reduces healthcare fraud and abuse. Let's discuss what kind of information HIPAA protects. HIPAA protects something called Protected Health Information, or PHI, in electric form that is electronic PHI, or ePHI. PHI includes anything that can identify a patient, such as full name, address, birth date, social security number, medical conditions, test results, health insurance information, or any other info tied to health or identity. You may be wondering, who has to follow HIPAA rules? HIPAA applies to two main types of groups. We've got covered entities on one side and business associates on the other. Covered entities include doctors, nurses, hospitals, clinics. They also include health insurance companies, pharmacies, dentists, and more. Business associates are any vendor or service provider that handles PHI on behalf of the covered entity. This includes billing companies, cloud service providers, IT consultants, and even shredding companies. So what are some key HIPAA rules? Here are some of the most important parts of HIPAA. The privacy rule, which sets rules for when PHI can be shared and with whom. There's a security rule, requires technical and physical and administrative safeguards to protect electronic PHI. We've got the breach notification rule, which requires covered entities to notify individuals and the government if there's been a data breach involving PHI. And we have the enforcement rule, which outlines the penalties for violating HIPAA. But what are those penalties? Well, HIPAA violations can lead to a lot of different outcomes. One being fines ranging from hundreds to millions of dollars. There's the loss of reputation or trust from patients, and there's criminal charges in some of the most severe cases. So if HIPAA came out in 1996, why does it still matter today? Well, in a world of digital health records, with emails, telehealth, mobile apps, and cloud storage, keeping patient data safe is more important than ever. HIPAA is not just a law, it's a framework for trust between healthcare providers and patients. So if you're in the Colorado Springs area and need help navigating the complexities of HIPAA requirements, visit our website, steppingforward.tech, and click the yellow Chat with Matt button to schedule a no cost, no pressure, and no obligation meeting with Matt today. Can't wait to work with you.